The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we'll be speaking with Kimmy Everman, who's a program specialist for the Department of Public Health and Human Services, all about Medicare. We're going to do a Medicare 101 from the A to the B to the C, even the D, talk about all those coverages, and then we're going to talk about how Medicare has been impacted by the COVID-19 pandemic and all of the new policies and procedures that you're going to want to know about. So make sure you stay tuned to today's Aging Horizons.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell, and today we'll be speaking with Kimmy Everman, who's a program specialist with the Department of Public Health and Human Services. Kimmy, thanks for being with us today.
Yeah, hi Katie, glad to be with you. Even if we're far away from each other, this is wonderful.
Yes, it is. It's always good to see your face, even if it's on a television monitor. Kimmy, I want to talk about Medicare today, and you know, as many times as we've had this discussion, I still like starting with the ABCs of Medicare. Yeah. So tell me a little bit about Medicare.
Sure, and I think that's smart because Medicare is, I call it a moving target sometimes because it can be very hard to understand everything. So if you know the basics, that's a great place to start. So the basics are A, B, C, and D. They're different parts of Medicare. And each different part takes care of a different part of a person's health care picture. So Part A is their hospitalization. Might call it catastrophic coverage, or might call it major medical. But it is a protection for going into a hospital and having, you know, a major life event with your health. And most people get Part A at no premium. That doesn't mean it's free. They've paid for it because they've worked for many years and their taxes have paid that for them. So most people, if you've worked at least 10 years full time, you get Part A at no premium. So you just have it as soon as you are Medicare eligible. Then Part B would be considered voluntary, although most people want to have it, and it's your outpatient coverage. It covers going to the doctor. It covers going to the lab. It covers some different testing types of things. The reason that some people might opt out is maybe they're covered by some other health insurance that's as good as or better than. But that doesn't happen a lot. That might be retirees with work coverage or something, but it isn't real common. Most people want Part B. And I want to mention, too, that veterans sometimes think they don't need to take Part B of Medicare because they have the VA to go to. And we want to remind our veteran beneficiaries that Part B is a very smart, very economical way to protect your health, that you should have that even if you do go to the VA for assistance, and call a SHIP counselor if you want to hear more about that. Then we have Part C, and that's a conglomeration of all parts of Medicare, A, B, so your hospitalization and your outpatient in one package. And then the one we haven't talked about yet is Part D, which is the prescription drug coverage part of Medicare. So in Part C, you may have heard of this called Medicare Advantage, a Medicare Health Plan, and they have a sort of a one-stop shop kind of operative where you get all those benefits through one organization, and it's a private organization that's giving you your Medicare benefits, but you are still a Medicare beneficiary. Very important to remember that whether you're in a Medicare Advantage or in the original, just having A and B and D, you're always a Medicare beneficiary.
And who is eligible for Medicare?
Well, you can get Medicare at age 65. If you are a person who has been found disabled by Social Security criteria, you may also get Medicare. But 65 is the magic number. And even though a lot of people are working till 67, which is a full retirement age, for many of us now, we still can get Medicare at 65. And for that age group, that 50 to 65 age group, it's important that they have coverage and that, maybe they didn't have it before, and when they turn 65, they get it. So it's really, I love Medicare for its great coverage and the economical price.
And if someone has questions about which Part B, which Part D they sign up for, where do they go?
Well, as I mentioned earlier, SHIP counselors, the State Health Insurance Assistance Program, those folks are highly trained, not only in Medicare kinds of things, but also they're listening between the lines to hear if you need anything else, or maybe you're just going to tell them outright you need something else for assistance. They're just great advocates, and especially with the Medicare piece of it, they really know what to do. If you're in a pickle, they know who to call. They know, what to say and where to look for ways of getting around something that maybe is difficult for a person. So those the SHIP counselors, sure, we'll run it on the screen, but they are in all the area agencies all around the state.
So when you call a SHIP counselor, you're talking to someone in Montana.
Yeah, and you're probably talking to somebody very close to your own community, because that's how their hotline works. Wherever you call in from, it calls to your local area agency on aging.
Great. So just as a summary, that 65th birthday, that's the trigger that people need to think about when they're thinking about Medicare for most people. And then make sure you call those SHIP counselors.
Absolutely. And, don't worry, and don't worry about doing it early. You may not be able to sign up, but going in early means you can learn. And the SHIP counselors love to help folks get educated about Medicare and all the there's programs we need to talk about for people that are lower income.
Sure. Well, and we will do that when we get back. So make sure you stay tuned.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
If you give or receive care, you already know that it can cause stress on caregiver and receiver alike. The good news is, if you have limited resources, help is available. The Montana Lifespan Respite Program may be able to help you pay for care while you take a break. Even better news is how easy it is to apply. You can get an application online or have one sent to you. We'll get back to you within 5 working days. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
If the Aging Network in Montana was a restaurant, the sign out front would say, over 50 million meals served over the last 30 years. Since adequate nutrition is critical to health and quality of life, nutrition services are an important factor in keeping older Montanans healthy, independent, and living in their community and home. To find out more about senior nutrition programs in your area, call 1-800-551-3191.
Welcome back to Aging Horizons. We're speaking with Kimmy Everman, who's a program specialist with the state of Montana, all about Medicare. Kimmy, I know that there are some programs that can help people cover those premiums for the Part B and D programs. Can we talk a little bit about those?
Yeah, Katie, there's several programs. Medicare Savings Program, which pays for a person's Part B premium. One called the Low Income Subsidy, or LIS, or also known as Extra Help, which is specifically to help with Part D, or the medication piece. And there are several levels of assistance in that program, so you can actually make a little more money, perhaps, than you might think, and still be eligible. And then finally, we have the Big Sky RX program, which I never want to forget. It's a homegrown Montana program. The benefit that they do is they pay a premium for your Part D plan up to a certain benchmark each year. And it's usually between $38 and $42 or so in there. So you can get a decent plan for that amount of money. If you want one that's more expensive than that and you still are qualified for Big Sky RX, you can pay the extra yourself. You can also do that in the low income subsidy program. But, the bottom line, Katie, is that those are Part B and Part D are the ones that have, the copays that are kind of upfront. So it's good to have those coverages to help you get better prices and not have to pay so much out of pocket.
Absolutely. And if people have questions about those programs, I'm guessing they call a SHIP counselor?
Absolutely, because, and the good part about those programs, you can sign up at any time. It's not on a clock. It's not, there isn't an enrollment period. So you can sign up anytime, which means why wait? If you think you are eligible for anything, just call. All you have to lose is 5 or 10 minutes of your time, and you may really enjoy talking to a SHIP counselor about it. And they'll, talk with you about whether or not you seem like you're eligible and go from there. It's an easy process.
Yeah, they're wonderful people. They're always great to talk to.
Yep.
Kimmy, I think that Medicare has probably had some very large changes due to the COVID-19 pandemic that we're currently experiencing. Can we talk a little bit about some of those changes?
Yeah, I think one of the best is the telehealth.
Sure.
And the rules that have been waived and relaxed about telemedicine, it does your heart good to know that people can get pretty much everything except surgery over the internet or on a phone. You can do, your basic checks with your primary care doctor. Now let's talk about if you think you have, or they think you have COVID during one of these telechecks. They're not just going to let you hang out there. If they think you have COVID, they're going to figure out a place close to you where you can get tested. They're also talking about developing in-home tests for some people that are very at risk. That hasn't happened yet, but they're working on it. And there's another thing that'll be, a way to protect yourself without even leaving your home. Another great waiver that has happened is the telemedicine with mental health. The rules have been relaxed so that people can talk to a counselor over their tablet, their laptop, their phone, and so they can text. They can do things that work for them now in the situation that we're in, that keep them safe and still have connection. And I think that is one of the greatest pieces of this. And then I don't want to forget to mention about the Part D sort of expansion, which is some people are going out very, very infrequently. And Medicare has said, call your Part D plan, and if you need to pick up your medication early, there will be some medications that will be okayed to do that, so that you don't have to make a bunch of trips to pick things up. So these are all things that I think are very exciting and very proactive. And also, I guess we have to remember that this is going to be with us for a while. And so these changes are ahead of the curve are so healthy, and I'm so happy to see Medicare stepping up to the plate to do it.
Yeah, these are pretty big changes for a program like Medicare that doesn't change, on a dime.
Right. Another one I just thought of that's huge is in terms of the COVID-19 testing. Medicare is going to allow pharmacists and health professionals that are not necessarily doctors to do these tests. Again, that hasn't happened yet. This is the rule change that just came out. So stay tuned, but that is huge. That puts so many more people into that frontline responder position to help people who just, maybe want to, and Medicare is going to pay for that testing in a tent in the Safeway parking lot or wherever it ends up being in your community. Again, stepping up to the plate to make sure that people are safe and secure, and they're trying to meet beneficiaries where they live right now, and that is an awesome thing to see.
Yes, absolutely. Kimmy, when we come back, I want to talk about just a few of our policy changes and then some of those scams and schemes we need to look out for.
Sure.
So stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Summer in Montana is a great time to visit your local farmers market. Enjoy the social atmosphere while shopping for a wide variety of fresh, locally grown produce. Together with both WIC and Senior Farmers Market nutrition programs, you help feed your family 5 or more daily servings of fruits and vegetables for better health. You also help local ag producers and enhance the state's economy. So, for summer fun that's nutritious and helps Montana's economy, shop at your local farmers market.
Sergeant Jones. Please respond. I was separated from my squad. Requesting backup. Anyone? Please respond. I'm all alone here.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Welcome back to Aging Horizons. Today we're speaking with Kimmy Everman, who's a program specialist with the state of Montana. Kimmy, we've been talking about COVID-19 and how it's impacting Medicare coverage. And I know Medicare has done some additional policy changes for people who are turning 65 during this pandemic. What are some of those?
Well, this is huge. And, again, I want to thank Medicare for getting ahead of the curve on this. It's called equitable relief. And the basics of it is, what if I turned 65 in, let's say, March of 2020, when everything was closing down, I couldn't get a hold of anybody to help me, I didn't know what to do, and I missed my window of time. This policy for the COVID-19 emergency, which is called equitable relief, is going to allow people to get into the system without the normal consequences of missing their enrollment date. And basically, they're not going to ask a bunch of questions about why. They have a date between March 17th and June 17th is a time when they're using that time frame for people who didn't get signed up that can call Social Security now or go online, which is even better if they can. It's not going to ask you to prove why. It's just going to say, okay. And I know, again, I think that what we need for our folks out there is easy right now. They're tired, they're despairing, they're worried, and what we need is to help them with some easy things.
Sure.
And from what I have read, it isn't going to be that complicated if you fall into this category where you need the equitable relief. But I'm going to say also, perfect time to call a shift counselor. Just absolutely perfect time. Because the shift director has sent this out and they're all reading it all over our state today or a few weeks ago. I guess we're not on today, but they're all reading about it and they know about it. And so they can help walk a person through the details of it.
Absolutely.
Yeah.
And Kimmy, I think anytime something like this happens, the scammers are not far behind. So I know that there are some Medicare-related scams that are happening now and probably will continue to happen for months.
Yeah.
Let's talk about a few of those.
Well, I just want to warn folks about there's scams with gloves, masks, test kits, actually medication that the scammers are saying will, keep you safe or vaccinate you or whatever. So they're really diving deep into the products, but they're also still diving around to try to get people's stimulus checks.
Sure.
And that's another thing that I just want to warn folks about. That is very much your money that you worked for, and it is to help you survive. And anybody that calls up and says, one of the programs I heard about, they're calling up and it's about an empowerment for aging citizens. Well, who doesn't want to empower aging citizens? But it's a scam. So be sure before you let go of that money, you check it out and make sure you know what you're giving to.
Absolutely. Make sure you go to the source. So if you think you're talking to a Department of Treasury, go to the Department of Treasury.
And our SHIP counselors can help with that, and our SMP counselors can help with that. Both are advocates for Medicare beneficiaries. That all you have to do is call your local area agency on aging and talk to one of them, and they'll help you out.
Absolutely. And just as a general rule, any type of treatment, testing, those will all come from a licensed medical provider. So a pharmacist, a doctor, a nurse practitioner. No one's going to come door to door with any kind of treatment that's been FDA approved or has been proved effective.
Absolutely. And, I think just stay in touch with your area agency, your SHIP counselors, your SMP counselors. Stay in touch with them, and they will help because they have their finger on the pulse of this almost as soon as these folks hit the ground. So we at least can fight back.
Absolutely. And there are so many great resources online right now for people to look at. The IRS has a lot of great resources about the stimulus checks. Medicare has a site where you can go in and check. But if you don't have online access, reaching out to those SHIP counselors is so important to be able to access those resources.
Right. And, we're hearing from people that don't have online access. And it is, I'm sure, very frustrating for them because the first thing we say is, go online to the website. But how about this? All you have to do is call a SHIP counselor. That's easy. Most folks have a phone, and if not, maybe you can go to your neighbor's house or a friend. But call the area agency on aging, and they will assist. Especially in times when people are nervous and worried and isolated and not knowing exactly what they can and cannot do. The SHIP counselors are so helpful. The people at the area agency are so helpful.
They're a part of the community and they want to help their community members. So
right, exactly.
Absolutely. Well, Kimmy, just as a sum up of today's discussion, I think the most important thing we talked about is calling that SHIP counselor. And people do that by calling the 1-800 number that we're going to put up at the bottom of the screen. They can reach out to them, ask any questions that they have, and be really helpful.
Yeah, and you know what? Even if you just need to talk to somebody because you've been alone in your home for weeks and weeks, it's okay to call the area agency. That's another thing they do is they just keep contact with people and they're happy to do it.
Absolutely. Thank you so much for being here, Kimmy.
Sure.
We really appreciate all the information you shared, and make sure that you are staying safe in your community. Have a great day.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.